Your Excellency, the Prime Cabinet Secretary and CS for Foreign Affairs, the Governor of Kisumu, His Excellency Professor Nyang' Nyong'o, and the First Lady, PSS President, the Chair and board members of the National Cancer Institute, including the CEO, the following partners, civil society representatives, healthcare professionals, cancer survivors and advocates, members of the Fourth Estate, fellow Kenyans, good afternoon. It is my honor to address you at this very important Second National Cancer Summit, a critical gathering where we reaffirm our commitment to saving lives, reducing suffering, and building a future where no Kenyan dies from cancer. Cancer is not just a health crisis. It is a national emergency. Every day, more than 120 Kenyans are diagnosed. Every hour, families lose their loved ones. Each year, close to 29,000 lives are lost. These are not just numbers. They are people with names, families, and dreams. But today we come together, government, civil society, researchers, our county governments, partners and private sector, and the public, not simply to talk, but to act. And the theme, Uniting Voices, Taking Action, is a call for urgency and solidarity. Our National Cancer Control Strategy 2023-2027 provides us with a very clear roadmap covering prevention, diagnosis, treatment, palliative care, financing, and research. We are decentralizing cancer care as a country. Our regional cancer centers are now operational in Nairobi, Eldoret, Kiambu, Mombasa, Garissa, Nakuru, which is a major step towards equity in access. Through the National Equipment Service Project, we are strengthening our cancer care by equipping our national and county referral hospitals with essential screening and treatment equipment. Mammograms have already been installed in Kisumu and Kerugoya, while CT scans are operational in 15 county referral hospitals, with installation underway in another 15 additional counties. Data is our compass. Our National Cancer Surveillance Platform is enabling real-time data to drive smarter, targeted decision-making. On prevention, the ministry has successfully integrated the HPV vaccine into our routine immunization schedule, targeting adolescent girls aged between 9 and 14 years. This is a momentum step towards the elimination of cervical cancer. We are expanding our community-based screening for breast, cervical, prostate, among other cancers, through community health promoters and mobile outreach teams. Early detection saves lives. We are also strengthening our referral system to ensure timely follow-up and care. No Kenyan should suffer or die because of delayed treatment. Through the Taifa Care, we are building a health system which is more inclusive, equitable, and responsive. The Social Health Authority is very central to this transformation with over 24.9 million Kenyans enrolled as of last night. Every day, between 40 to 50,000 Kenyans enroll on our platform. The Social Health Authority provides up to 550,000 per year through the Social Health Insurance Fund, an emergency, chronic, and critical illness fund for cancer diagnosis and treatment. Additional services covered include surgical procedures, inpatient care, outpatient care, and palliative care in line with the SHA benefits and tariffs. No Kenyan should be forced to choose between treatment and feeding their family. The government, under the leadership of President William Ruto, has made it very clear that the health of our citizens comes first. To date, SHA has received oncology claims amounting to 5.8 billion in the last 9 months, benefiting 49,315 patients who have accessed various oncology services, including the following: 15,300 patients received chemotherapy, 2,200 underwent radiotherapy, 2,609 accessed the PET scan, and 1,390 went through, under the SHA program, CT scan. And thousands more have benefited from other cancer diagnostics and intervention. We urge all Kenyans to register and contribute to the Social Health Insurance Fund. This is your protection. This is your family future. To further strengthen access to oncology care, the Ministry of Health, and I want to say it with a lot of pride, that we have signed an MOU with Roche, and I'm sure they're here, one of the biggest pharmaceutical company, to provide Herceptin 600 milligram SC and other products, therapies to eligible SHA beneficiaries. Please, let's clap for Roche, a biological therapy that is used to treat breast cancer and gastric cancer, which make up 15 to 20% of all the cancer cases. It's a critical addition in the fight against cancer. This partnership we have with Roche has reduced the cost of treatment from 120,000 Kenya shillings to 40,000 per session, fully covered by SHA with no co-payment for our patients. These therapies will be available across all SHA contracted healthcare facilities nationwide. They can be found both in the public, private, and faith-based. And this is to ensure equitable nationwide access. The ministry, under my leadership, encourages other pharmaceutical partners present here and those who are listening to us to join in expanding access to affordable, patient-oriented, and high-quality cancer care. However, ensuring access to therapies must go hand in hand with early detection. Over 70% of cancer cases are diagnosed late, mainly due to limited access, stigma, and misinformation. We must expand diagnostic and radiotherapy services in the most undeserved areas and promote early health seeking by normalizing cancer conversation. Geography must not determine survival. To our county governments, please prioritize cancer in your budgets. Ring-fence funding for screening, public education, and referral infrastructure. Decentralized action is very essential. To our healthcare professionals and researchers, lead with evidence, compassion, and innovation. Train the next generation, generate local data, improve the outcomes. To our partners and the private sector seated here, work with us. Invest in localized, affordable cancer care solutions that are scalable and sustainable. To the media, civil society, survivors, and our citizens, use your voice, raise awareness, break stigma, support one another. Early detection saves life. Let this summit be remembered as a moment we shifted from plans to impact, from words to action. Let us unite our voices and deliver a future where cancer is no longer a death sentence, but a challenge. We meet with courage, equity, and national resolve